By watching this video, you'll understand the client intake and assessment process from start to finish and what happens next. The more you know about the process, the better you can guide and support your loved one.
Pathway to Care and Recovery, Alicia speaking. How may I help you?
When your loved one who has been struggling with an addiction says they're ready to try treatment, your support may make the difference. Maybe even with getting them to a place to start that journey. In Allegheny County, Pathway to Care and Recovery is the organization designated to be one of the main front doors to access SUD treatment and recovery services. This video walks you through the steps for walk-ins to their downtown facility. There are 7 basic steps that happen at Pathway to Care and Recovery when your loved one arrives, either alone or with a trusted family member or friend. They are welcoming you to the facility, doing an initial intake with basic questions, having a health check-in with a nurse, doing what's called a level of care assessment, deciding on the best facility that meets your loved one's needs, then checking immediate availability, offering a safe place to stay if a bed is not immediately available, and making a warm handoff of your loved one from PCR to staff from the facility so they can start their recovery journey. Staff from PCR describe each of these steps.
During the intake process, staff will gather basic information, fill out consents and other agreements, as well as complete the screening process.
The screening process is an important step of the intake process, and it identifies urgent needs of clients that require immediate attention,
including withdrawal management, prenatal, and psychiatric services.
After an individual completes the intake process, they will meet with a nurse to complete a physical assessment to assure stabilization, as well as collect medical histories and provide medical screenings.
If a client becomes ill, the nurse will evaluate the seriousness of the illness and make appropriate recommendations to the client. Staff will assist with transporting client to care when needed.
After the nurse is done, the client will meet with the assessment specialist. A level of care assessment utilizing the American Society of Addiction Medicine's criteria takes into account a client's needs, obstacles, and liabilities, as well as their strengths, assets, resources, and support structure. This information is used to determine the appropriate level of care across the continuum.
What does an unbiased assessment mean?
Pathway to Care and Recovery operates on a principle of no judgment, just care.
What's my role in the intake process?
Staff will provide support to loved ones during the process. Should the client elect to have their loved one present in the office during the process, they can be in the room. Each client's care is individualized, and staff use as much time as needed to complete a thorough assessment of a client's needs.
Will my loved one's rights be protected?
Confidentiality of all our clients is of the utmost importance to us. We will keep all of their information private unless they sign a release of information providing consent to do otherwise. We strive to make the process as stress-free as possible for families and ensure them that if they need to leave while their loved one is receiving services at PCR, they can. And we will update them with any information as long as the client agrees and signs a release of information.
How can I make the process easier for my loved one?
Family support and encouragement plays an important role in their loved one's motivation to enter treatment. It is helpful if they remind their loved one to be as honest as possible.
Why is honesty during the intake and assessment process important?
It is important for a client to be honest during the process so staff can work with them and link them to the most appropriate provider. Staff provide substance use screening and level of care assessments in an impartial manner so that determination results or referrals go to the most appropriate service or program. Referrals will be consistent with the findings from the level of care assessment and the individual's preferred recovery path and provider. After a level of care is recommended by the staff and accepted by the client, a provider search begins, either with the assessment specialist staff or a drug and alcohol case manager. Does the person have any preference or choice of a particular provider? If not, the staff will provide the client with options that would be a good placement according to the information that has just been gathered. Once a provider is identified, staff will call the provider and attempt to gain admission and an admission date. If there is a wait time for admission, the safe place to stay is offered in the interim.
What about payment?
Pathway to Care and Recovery will help a client regardless of insurance status. All services are provided free of charge. You will never receive a bill from PCR. If a client is open to receiving help with applying for insurance, staff will help them with this process while at Pathway to Care and Recovery.
If a client is accepted by a provider, the staff will make the client as comfortable as possible in the waiting room until pickup time. Staff will also assist the client with phone calls, notifying their support system and family members of their treatment decision and plan.
What if no treatment beds are available at a selected provider?
If a bed is not available at the client's preferred provider, staff will provide the client with other treatment options that they think might be a good fit for them, according to the in-depth information gathered during the assessment process. Clients have the opportunity to attend educational groups, work on treatment and non-treatment needs, access the laundry, and maintain contact with any family or community supports.
Staff will continue to meet with clients and provide support while they are in the safe place to stay.
The individual will be assigned a private room on the 7th or 8th floor, room key, and be given an overview of what to expect. The nurse will monitor all individuals in the engagement center and safe place to stay for signs of withdrawal symptoms or complications, medication side effects, and any emerging signs of medical issues or mental health.
A Certified Recovery Specialist, or CRS, will be available to all individuals who would like additional support throughout the entire process.
When the established bed date arrives, staff will complete the Safe Place to Stay exit form and transport the individual to the location safely. Staff will facilitate a warm handoff on site or facilitate the warm handoff at PCR if the provider is picking up the person here.
Understanding the process will help family members advocate for the best possible treatment option for their loved ones.